Hyperemia and congestion are two terms you would often hear when talking about blood flow and circulatory changes. Both are associated with collection of blood in the capillaries, but they refer to different phenomena. In hyperemia, arterioles actively vasodilate to increase capillary inflow in response to a stimuli such as exercise, inflammation, allergies, or heat exposure. It's usually a physiological response, and the vasodilation serves to increase the blood flow to meet the metabolic demands of the tissue. The inflow of blood into the capillaries should about equal the outflow, and there is no blood stasis although the vessels appear engorged. The affected area usually appears flushed and warm due to the increased blood flow. Congestion, however, is a passive process and is usually pathological. In congestion, there is an accumulation of blood in the tissue or organ consequent upon impaired outflow from the area. The outflow may be obstructed due to local causes such as venous thrombosis or systemic causes such as congestive cardiac failure. The obstruction causes trapping or stagnation of the blood in the capillaries with disruption of tissue oxygen delivery, leading to tissue hypoxia and sometimes cyanosis. Blood vessels are distended and engorged, with edema tending to occur together with the congestion because of increased venous hydrostatic pressure from the blood flow obstruction. Congestion in the lungs is a feature often seen in association with pulmonary edema. This is because pulmonary edema most commonly results from left ventricular failure or left valvular disease that then obstructs the outflow of blood from the lungs through the pulmonary vein and the left cardiac chambers. In addition to the engorged, dilated pulmonary blood vessels due to congestion, in the presence of fluid-filled alveolar spaces associated with pulmonary edema, one may also appreciate the presence of hemosiderin-laden macrophages in chronic pulmonary congestion. This occurs due to rupture of the congested capillary, which release the red cells into the interstitial and alveolar spaces. The red cells are phagocytosed by tissue macrophages, releasing the iron which remains in the macrophage, giving rise to the iron-laden macrophages, sometimes referred to as heart failure cells. Another organ that can often be affected by congestion is the liver. Liver congestion usually occurs due to disturbances to its blood outflow. Common causes include congestive cardiac failure, cor pulmonale, and inferior vena cava obstruction. Chronic congestion in the liver is observed as dilated, engorged centrilobular veins due to the obstructed outflow. In long-standing liver congestion, central hepatocyte atrophy is seen because the cells surrounding the central veins experience chronic hypoxia. Grossly, cross-sections of the liver may show a nutmeg appearance due to the congested and dilated central veins and sinusoids, which resembles the appearance of a sliced nutmeg seed.